So essentially, we started an initiative called Capsule Kids on the cardiac ward at Great Ormond Street, which is an initiative based off of Pill School, which has been performed in Evelina Hospital and also in Newcastle Hospital. So the main aim of this project is to help children transition from taking liquid medicines to tablets and capsules. And there are huge benefits to swapping patients over. So that includes a decreased carbon footprint. Often liquid medicines have a higher carbon footprint due to the excess packaging involved. So it's often a bottle inside a box with some syringes and bungs attached, all of which can contribute to your carbon emissions. Whereas a tablet and capsule is generally just in a blister pack in a cardboard box. So it has a lower associated carbon footprint. But also when it comes to expiries and using new bottles once opened, it's more sustainable to have tablets and capsules over liquid, especially because a lot of the time parents, nurses, they don't appropriately label those liquid medicines when they are opened. And so we can never be sure of when that then needs to be discarded. And it leads to more bottles being opened, more wastage, and also leads to storage issues. There's also a financial saving. In general, tablets and capsules are cheaper than liquid medicines, and that's because of all of the excess packaging and excess excipients and raw materials involved with the manufacture of liquid medicines. But also there's a lot of benefits to the patient. They would then have to carry a smaller pack size as a tablet capsule, much more easy, especially when the patients are going on school trips or if they need to keep a pack at school. And it also helps with adherence because sometimes these liquid medicines that we give them don't taste very nice. Patients, particularly with learning difficulties, can have aversions to particular colors of liquid medicines. And also when it comes to the excipients involved in liquid medicines, some of them can even be detrimental to children. So some of them can include alcohol, sodium benzoates, phenol, butyrates, all of which can cause things like CNS depression, and it can cause a lot of side effects in children.
In terms of the method and how we carry this out, as mentioned, on a cardiac ward, and we focused on children over the age of 4, as the current data that is out there suggests that children as young as 3 have the capacity to swallow whole tablets and capsules. We predominantly, for the scope of this project, focused on children that went through heart and lung transplants because they're on medications that are lifelong. So instilling the concept of taking pills and capsules at an early age will help contribute towards more adherence because it's something that they'll have to take forever. And also in terms of the cost implications, there would be a more cost saving because these medications predominantly are hospital bound. So they cost a lot more and wouldn't be something they'd get from the community. It was facilitated predominantly by myself and Snehal and our ward technician. And we worked together where patients that were being stepped down from ICU were having the prescriptions amended prior to coming to the step down cardiac unit, switch from liquids to tablets, at which point we would step in and have the conversations or the training with the children and parents on the benefits of taking capsules and tablets. So we demonstrated things like swallowing techniques and used aids that were also used at the Evelina on ways to improve adherence to these whole formulations.
So in terms of our results, we did have a lot of cost savings and also carbon emission savings generated from this. So at the end of the project, if we initiated it in 5 patients over 6 months, but if we projected that over a year and said we had 10 patients, then it would have led to 972 miles in a car saved worth of carbon emissions, and also around £258,000 worth of medication costs.
In terms of the social outcome and the patient outcome, For us, we had anecdotal evidence to suggest that a lot of the children felt empowered because they were incorporated into the decision making of the condition and their medication. There's an increased improvement in patient safety because we're not worried about meals being misread and given wrong doses. And as you mentioned earlier, it's easier to transport, there's more palatability. And with the ongoing issues with medications having shortages, which is predominantly associated with liquid medications, switching children over to pills and capsules meant that there would be less hassles with dealing with shortages. This also meant that there was a benefit for for staff as well in administering medications as well. Overall limitations was staffing levels. This project was carried out by 3 pharmacy staff, and with sickness and leave, that meant a few patients were skipped in terms of results. It's not applicable to every medication, and the patient cohort was small, so expanding it beyond transplant would be great for future references and data collection, and perhaps more access to funding and resources to improve patient experience.